Sono fiero di poter essere qui a presentare il
I
lavoro che la Regione
am
Piemonte ha
honored to be
fatto.
here to
Permettetemi una
introduce the work
piccola,
that my
una
region
breve
has done,
premessa
but
per
I
portare
would like to say
il lancetto
something,
del tempo indietro
and
a
I would like to
quelle
go
prime
back
ore,
in
quei primi
time
momenti drammatici
to the first
in cui
hours, the first
si manifestava
seconds,
in tutto il mondo
the
la pandemia, in
first
particolare da
dramatic
noi.
times in which we
I
were
giorni in cui
living
il
through this
Covid
dramatic
galoppava
pandemic.
veloce,
In
aggrediva
the
la
first days
popolazione
of the pandemic,
e
this virus was hitting the
aggrediva la
population
popolazione senza quasi mai
violently,
trovare
without
resistenza. E questo
without
virus
ever
che
seeing
mieteva
any
vittime,
resistance,
soprattutto tra gli anziani.
and
E
this
la domanda
virus
che
killed
ci siamo
many
posti tutti
elderly.
era: cosa
And the
possiamo
question
fare?
that we asked
Cosa possiamo
ourselves
fare di
was,
fronte a
what
questa
can we do?
minaccia? Che cosa
What can
dobbiamo
we
fare?
do
Una
to
delle prime
combat
risposte
against
che ci
this
arrivò
threat? What can we do? One of the
tachipirina
first
vigile attesa,
answers
che ha poi
was
determinato una serie
tachipirina
di
and waiting,
ospedalizzazioni drammatiche.
and that brought us
Molti
to
medici,
a
e
lot
noi
of
abbiamo accompagnato
hospitalizations.
questi medici, hanno
Many
cercato di
doctors
prendere
that
in
have
carico
worked us
precocemente il paziente a
have
domicilio,
tried to
con
take
l'obiettivo di
in charge
intercettare il malato,
home treatments,
ridurre il ricorso al
trying
ricovero in
to
urgenza
cure
ordinaria o
the
terapia
patient
intensiva,
before going
cercando
into
di
the
dare
hospital,
tanto
or
con protocolli
reducing the time they
farmacologici
spend in the
inizialmente
ICU, and trying
di
to
prova
develop
sperimentali,
a
cercando di dare una
drug
risposta.
protocol that was
Allora
experimental, trying to
il
give an
lavoro
answer.
di un decisore politico, che è quello che abbiamo
So
voluto
the
spiegare
job
noi,
of
è
a
stato di
political
accompagnare
officer
questi tentativi,
was
accompagnare questa
to
seconda strada.
accompany and support this
dare ai
road, this
medici
decision
impegnati sul
making,
territorio
and to
tutti gli
give
strumenti
doctors
leciti
on the
possibili
field
da
all of
percorrere
the
in
tools
questa iniziativa.
needed to
Allora vi
use
dico che
during this initiative.
l'organizzazione, in questo caso l'organizzazione
So let me tell you that
efficiente, è
the
davvero
organization,
la
an effective
prima
organization,
medicina.
is the first
Prego di proseguire
cure
sulle slide.
against COVID.
Ecco, la realtà del Piemonte è una realtà storica che vede già una visione
Piedmont
organizzativa
is an
del
historical
territorio
situation that
strutturato.
has a
Nel
very good
98
organization,
è stata varata la prima rete
and in
oncologica italiana.
1998
Dopo l'Emilia
there was the
Romagna,
first
negli anni
oncological
successivi, nel
network.
2001, la rete
After
del 118.
Emilia-Romagna in
Il primo
2001,
master
the first
italiano in infermieristica di famiglia, oggi
911
chiamiamo di
network.
E
The
l'emergenza
first
Covid, col suo
master
devastante
in
impatto
family
in una delle
medicine.
regioni con la più alta popolazione di anziani
And
residenti, ha trovato un tessuto,
this is one of
diciamo,
the
consolidato
region that
di
was
sinergie
worst
tra ospedale e
impacted,
territorio,
but
che ha
it has a
potuto
very
essere
good
così
structure and a very
leggermente
good
più efficace.
organization, and this system has been particularly
Le
effective.
forme assistenziali del Covid per intensità di cura che abbiamo
So
determinato
assisting
a domicilio
with
con pazienti
people with
con
COVID
rete
at
familiare
home
presente, un quadro clinico sostanzialmente stabile.
with
Abbiamo realizzato
a
il Covid
stable
Hotel per pazienti con problematiche
situation.
logistiche
We
e
created
organizzative a
COVID
domicilio,
hotels for
impossibilità di
people
spazi di
with
isolamento,
difficulty
di
staying at
quarantina,
home
eccetera,
and
nelle
for people who
strutture
needed to
residenziali per
quarantine.
anziani nelle RSA,
And we
con un livello
created
assistenziale
a quarantine
intermedio,
station at
senza
nursing
supporto
homes
intensivo, ma con necessità di assistenza
without
infermieristica. E
ICUs,
infine,
but
come opzione
for people who
residuale,
needed assistance.
l'ospedalizzazione in pazienti
And then
stabili.
we had, as a last resort, for patient stable hospitalization.
Proseguiamo, prego. La prima esperienza
The first
consolidata
experience,
è avvenuta
consolidated
in una
experience,
provincia del Piemonte,
happened in one of
che
the
è
provinces
vicina
of Piedmont,
all'area dove si è
the
sviluppato in Lombardia
one that is
il primo
closer
focolaio Covid.
to the
Le prime
first
sperimentazioni di questa gestione
outbreak in
territoriale
Lombardy,
sono decollate già nel
and
marzo del
this
2020
assistance,
in questa provincia,
at
provincia
home
di
assistance,
Alessandria,
increased in
in
March
particolare sul
2020
distretto di
in
Alto
the
Terno,
Alessandria
una realtà
province.
di consolidata integrazione ospedale-territorio.
This
che
is
dal
a
18 marzo
situation
al
where we
30
have a
aprile
good
2020
organization,
ha visto
and
gestiti
from March
interamente a domicilio
to
340 pazienti,
April
con
2020
solo
saw
9 decessi e
340
22
patients
ricoveri,
with
un
just
tasso di
9
mortalità
deaths
del
and
2,6%
22 hospitalizations.
in un periodo in cui la
Mortality
mortalità
rate of
sul base provinciale era del
2.4%
17%, e un
at a
tasso di
time in which
ospedalizzazione
the whole
del 6,5%
average
al
was
confronto di un
17%
tasso atteso
and a
del
hospitalization rate of
22% su base nazionale.
6.5% against a
Ci rendiamo conto
22%
che
that was expected
la
on a national
robustezza
level.
statistica di questi dati
We
sono
realize
stati,
that the
insomma, non c'è stato un
statistics
protocollo randomizzato, una sperimentazione, ma
in this
sono molto
case was a
significativi.
randomized
E per
experimental
fare questo,
protocol,
ai sensi
are
anche del
based
DPCM
on
del 24
experience
marzo, del marzo
and
del
also
2020, chiedo scusa,
through the law from March 2020, we created special units of continued assistance. We had hundreds of nurses and thousands of doctors, and these were incredibly important when they were on the field with good organizations together with GPs, and they work great, and we would like to keep this model working. Right now we have 90 of these units, and we have hundreds of nurses, and in 7 months of work, these units have cured about 48,000 patients at home, and out of this, 3,700 were in nursing homes. In March 2021, there were 10,600 patients with 3,500 per week cured at home. An important thing is patients cured at home with a more severe condition, and when it was needed, we also used oxygen at home for 2,800 patients, 1 out of 4, with oxygen that needed to be given to patients who needed it most. And this was managed by these units of continuous care units. We also had administrative personnel and people who worked at these units. We had very important tools, such as cardiographs and specialized doctors, and we all use these tools. We also created, to coordinate better the different national health companies, we created a series of tasks.
Passiamo subito alla slide numero 8. La costituzione di un gruppo di terapie
at different departments with the creation of different home therapies. So, in the absence of national guidelines, we created a specific group, and then we gave useful information for home treatments to doctors on the basis of the experience we had in the Alessandria province. These protocols have been introduced in the June 2020 region conference. And this group decided who had to do where, how, and when. They defined protocols, treatment protocols based on evidence, and that also taken into account the successes that we saw in the field.
Ho parlato di questa, mi faccia quella dopo, gentilmente. Ecco.
Next slide, please.
I protocolli che sono
Now,
poi concretizzati sulla base del lavoro di questo gruppo
have become protocols on the basis of the work of this group, with the objective to cure patients at home in synergy with doctors, GPs, the doctors from the continuous care units, and the taking in charge at the beginning of the symptoms. In March 2020, there were the first draft of the protocols, and then we had November 2020 protocol, and then we updated it after the use of hydroxychloroquine off-label, and the most recent protocol is from the 26th of March 2021, and so we have the different ways to cure different people. So we took into account the different health companies, the ministers, the prefecture, so all of the people who take care of the citizens. And this protocol divided all of the tasks and the individual tasks to make home protocols work. At the same time, we created support initiatives, meaning prescription of oxygen and its home delivery within 2 hours of demand. And this was monitored by the regional health company, and then we had different advices on the nutrition and the posture of the patient. So we cured these patients at home. Moreover, we also had documents that created different decisions to send different patients who get to the ER alone. So we had all of the numbers, contacts to divide these patients. So this created decisional processes for the Piedmont region, and these protocols also have taken into account not only the pharmacological point of view, but also the taken in charge by the hospitals and the system. Then we have seen the different protocols and the use of different drugs. I'm not a doctor, so I can't say anything about hospitalizations, but as far as I'm concerned, as a political decision maker, was to grant to our doctors any tool possible to manage the majority of the patients, reducing the pressure on hospitals and making hospitals ready for other different cures and different treatments. Out of 12,000,
noi ci siamo trovati nel picco della seconda fase della pandemia.
At the peak of the second wave of the pandemic, we had 5,300 hospital beds that were occupied out of 12,000 beds, meaning half of them were full. So this meant a lack of treatment, and after the number of deaths that we had, this will be the highest cost that we will have to pay. Think about the oncology, the cancer diagnosis that we missed. So the fact of occupying fully the hospitals, this is particularly difficult. So we have to use any tools possible to create home treatments. This is our effort, and we will try to do it as much as possible.
E buon lavoro a tutti.